I'm here today to launch NHS England's call to action for improving eye health and reducing sight loss. There is no better place to launch this than here today, with so many of you here interested in this particular area and many of you affected by it. And it's your voice that we need to hear.
The call to action for eye health is a huge opportunity for the eye health sector to really get a conversation about the ways that services and how we deliver eye care and eye health can be redesigned to support the NHS in meeting the challenges that it faces.
We have two areas that I think are really important. The first is prevention of loss of sight. And the second is around the service delivery. And we want people's ideas on how we can improve that.
You know, the final outcome that NHS England is looking for is that the results of all of the call to actions will be put together and that it will develop a new strategy for primary care.
The call to action will last until the 12th of September, which is 3 months. After that, there'll be a consultation period, and we'll then be suggesting to commissioners using the patient groups and the patient representatives that are here today to make sure that we improve the services for those with low-sightedness and loss of sight. We live in a new age of medicine where much more can be done closer to the person's home or their society or their workplace. And we must look at ways that we deliver that care more effectively in the community.
There are so many calls on the NHS, and there are so many groups that want to promote the interests of the people that they represent. And so getting traction for sight loss issues is sometimes very, very difficult. And you know, sight loss is still doesn't receive the priority that it needs to receive. So it signals to us that the NHS England are really starting to take sight loss seriously.
I hope that what it will achieve is a much fairer eye health service where people really, from no matter what background, no matter where they live in the country, can access the services easily. That they understand why they've got to do it. So overall, we prevent more people from losing their sight.
We are here to try and reduce the burden and to improve the services for those who suffer from the burden. And I hope that our call to action and your ideas will help galvanise us into doing that more effectively.